Today I'm going to be talking about depression in the senior years. So why is depression so common in the senior years? And I think Dr. Harden talked a lot about the changes that happens as we age. And a lot of those changes, unfortunately, can affect our the quality of life, the enjoyment of our life. And that's one of the things that can raise the risk of depression. So, but is it considered a normal part of aging? I think a lot of the changes that Dr. Harden described, unfortunately, a lot of those are normal parts of aging. But depression itself should not be considered just a normal part of aging. Depression, unfortunately, is pretty common. It's about 15% of people who are over the age of 65. So it is, unfortunately, a pretty common thing. So some of the risk factors, but just the fact that somebody's had depression in the past really raises the lifetime risk of depression in the future as well. Also medications. Certain medications can raise the risk of depression. And that's one of the classic ones there, long-term use of steroids. This is kind of like the best part about the talk, and that is that you don't have to, if you have depression, you don't have to just live with it. You don't have to accept it. There's treatment for depression. There's medications. Citalopram is just one example. There's a whole list of medications that really revolutionize the treatment of depression. These medicines are very effective, but they're very slow. You need to probably wait at least 2 weeks, before you might see any improvement at all. Now, if you have a loved one who has depression, how can you help them out as they go through this? And so those are a couple of things that might help. So I think if you're a family or a friend of somebody who has depression, then those are some ways that you can help out. So, like for example, if that person's been told by their physician, you can't drive. So simply taking them to their doctor's appointments can be very helpful. I just want to talk about some of the community resources. I have a few things listed there. I'm going to talk about those. Partners in Crime. Okay, yeah, I'm familiar with that one. It's basically, it's kind of like a community center. And there they have, there's a little exercise place. They have an amazing schedule. Almost every day there's probably 20 things listed there that's going on throughout the day. That's a really good community resource just like 2 blocks away from here. So there's one called Pro Seniors, and so it's a free legal support. And always, just your primary care physician. So they're also a good access point for what kind of community resources are available for you out there. So how can we keep our minds healthy as we age? One way is just the healthy lifestyle. Keeping active, exercising is really important. Keeping active mentally, like Dr. Harden talked about, use it or lose it. They've actually done some research showing that people who are active socially, they meet people, they play board games. I think chess was one of the ones they talk about. Doing crossword puzzles. They find that they mentally they tend to do a lot better.